Hello everyone, I'm Dr. Abhishek Shah, a periodontist and implantologist practicing at Denticare Dental Care Center, Surat, a 5-story multi-speciality hospital in the heart of the city. Also, I was the president of Indian Dental Association Surat branch last year. Every year on 20th of March, the World Dental Federation, also known as the FDI, celebrates the World Oral Health Day. The reason for this is to create awareness among the general population as well as to bring down the burden of oral health diseases on the affected individuals, on the healthcare system and the society and the economies at large. Nearly 3.5 billion people worldwide are affected by oral health related diseases. It is rightly said that the mouth is the window to the body, and oral health is one of the fundamental foundation pillars of general health. If oral hygiene is not maintained properly, then due to the buildup of harmful bacteria, this can cause tooth decay and gum diseases. This eventually will lead to the entering of these harmful bacteria in the bloodstream. Now, it has been proven through many scientific studies that there is a direct correlation between the oral health and if you are not maintaining it properly, the gum diseases with systemic diseases such as cardiovascular diseases, diabetes, respiratory issues, even preterm low birth weight. And now the recent studies are showing a direct relationship between gum diseases and the severity and progression of COVID-19 related complications as well. Also, many of the systemic diseases manifest in the oral cavity, sometimes at a very early stage, and that is why a timely visit to the dentist will help catch these diseases at a very initial stage. These diseases can manifest in the cheeks, lips, tongues, gums, etc. So in short, good oral health is very necessary for all of you to maintain a long and healthy life, which will also help you to smile, chew, taste, swallow and speak with confidence without pain. Some points to remember are: always brush for 2 minutes twice a day, use a soft toothbrush, never share your toothbrush with anyone, discard your toothbrush after a few months when it is worn out. This brush is not going to reach between the teeth, so always focus on interdental cleaning aids such as an interdental brush, a dental floss, or nowadays even a machine called a water flosser is available. Avoid high sugar diets, avoid excessive consumption of alcohol, avoid tobacco and smoking. Have a nutritious, healthy, fibrous rich diet. Also, get your teeth replaced at the earliest, because missing teeth will cause drifting of the neighboring teeth in that area and bone loss and will cause a chewing imbalance. So in short, visit your dentist very regularly, get cleaning done regularly. To conclude, I would say that an ounce of prevention is worth more than a pound of cure. Thank you.